Welcome to Medical Student. Today we're going to talk about the polycystic kidney disease. So before wasting time, let's jump into the diagnostic. Polycystic kidney disease is an inherited disorder in which multiple cysts develop in your kidney. Alright, so there will be multiple cysts in the kidney. The World Health Organization classification recognized two distinct disorders. One is autosomal recessive polycystic kidney disease and the other is autosomal dominant polycystic kidney disease. Do you really understand? Now let me tell you what does it mean. Actually, we do have the autosomal recessive polycystic kidney disease and we do have the autosomal dominant polycystic kidney disease. Alright, so this autosomal recessive polycystic kidney disease is actually have the short life expectancy, have the early onset, have the more lethal, okay, it is more lethal, and progressive renal failure. Okay, so progressive renal failure. Now autosomal dominant polycystic kidney disease have the late onset, reduced life expectancy, all right, reduced life expectancy, less lethal, and flank pain will be there. What kind of flank pain? Actually it will arise from your back and it will into your groin area. Okay, so arterial hypertension will be there, arterial hypertension will be there. All right, so autosomal recessive polycystic kidney disease have the short life expectancy, early onset, usually it is occur in the children, right, and more lethal, progressive renal failure will be there. Okay, and autosomal dominant polycystic kidney disease do have the late onset, reduced life expectancy, and it is less lethal, flank pain will be there, and arterial hypertension will be there. All right, now let's go to the description. So it have the short life expectancy and rare surpass childhood. All right, and autosomal dominant polycystic kidney disease have the reduced life expectancy in adulthood. Okay, and the severity varies significantly depend on the underlying cause disorder. Okay, now onset of autosomal recessive cystic kidney disease is usually in infancy or childhood. I have told you before, it is an infancy or childhood disease. All right, and progressive renal failure will be there in case of autosomal recessive polycystic kidney disease. Now let's see the diagnostic. Actually, the positive family history will be there. Positive family history mean that it is an inherited disease, so of course someone in your family is carrying the gene, okay, and have this problem. Now physical examination, they will be palpable, okay, bilateral abdominal mass, upper abdominal mass will be palpable, okay, and not tender to touch. Now ultrasound, you can see the autosomal recessive ultrasound appearance and the autosomal dominant. So autosomal recessive enlarged kidney will be there with multiple cysts bilaterally. Okay, so both kidney have multiple cysts. Okay, and because of the cyst, the kidney will be enlarged and increase echogenicity. Now let me tell you what does it mean by increased echogenicity. Actually, echogenicity is a reflection of ultrasound from the solid tissue. Okay, so once you do the ultrasound, so your solid tissue is showing reflection. All right, and now this cyst in your kidney, the cysts which are forming in your kidney, there are anechoic. Okay, there are anechoic, mean that there are liquid filled cysts. So once you do, let me show you the clear image. Okay, now this is the ultrasound image. So now you can see here is a cyst, here is a cyst, here is a cyst. So these are the multiple cysts in your kidney. Okay, ultrasound showing you. Okay, and now you can see the other area, you can see the other contrast area. So here is the more reflection, here is the more reflection, here is the more reflection, but this area where is the cyst, have anechoic. Anechoic mean that it doesn't show any reflection in the ultrasound. Do you really understand, guys? So now that is the reason. And hepatic cyst will be there in case of autosomal recessive polycystic kidney disease. So just hepatic cyst will be in the autosomal recessive polycystic kidney disease, not other cyst, not the pancreatic cyst, not the splenic cyst, not the other cyst. Okay, because it is an early onset and the patient usually die because of this cyst. Okay, so now the autosomal dominant polycystic kidney disease, it is actually the adult disease. All right, and usually age around 50. Okay, so age around 50, enlarged kidney with multiple cysts bilaterally, okay? So varying size, anechoic masses will be there. And hepatic cyst, pancreatic cyst, splenic cyst may be visible in case of autosomal dominant polycystic kidney disease. Do you really understand, guys? Now let me tell you the rule of two. There is a rule of two, okay? So rule of two mean that if your one kidney have the two cysts, okay, and if your other kidney have the two cysts, so you don't have the polycystic kidney disease, you are a normal guy, okay? Because mostly many people have the cyst, like the two cysts in one kidney, two cysts in another kidney. But let's suppose if you do have the three cysts in one kidney and the other kidney do have just one cyst, so it's mean that you have the polycystic kidney disease. All right, you have the polycystic kidney disease. All right, now let me tell you, here you can see I just highlighted it, okay? So this is the cyst, here is the cyst, here is the cyst, and these are the just reflection, mode reflection in the ultrasound. So here is increased echogenicity and here is anechoic. All right, so now see in the endoscopy you can see here is the cyst, here is the cyst, and all are the liquid filled cyst and many more cysts inside your kidney, okay? So there are the thing. Now in autosomal, okay, so there will be Porter sequence. In autosomal recessive polycystic kidney disease, there will be Porter sequence. What does it mean by Porter sequence? Actually, let's suppose it's a mother and having a baby. Now here is amniotic fluid, okay? So mostly the baby lungs are inhaling this amniotic fluid and the lung are swollen enough, okay? So now if you do have the decreased amniotic fluid, so your lung will not be swollen, your lung will be collapse, okay? So your lung will be collapsed. So in this Porter sequence is actually associated with autosomal recessive polycystic kidney disease. So there is a decreased amniotic fluid, so lung will be collapsed, okay? And there is oligohydramnion, there is a twisted skin, twisted limb, okay, and twisted ear, okay? Twisted ear will be there, and the what else will be there? There will be renal problem, mean that the genitourinary system problem will be there, okay? So these are the Porter sequence which will be associated with the autosomal recessive polycystic kidney disease. All right, so that was all about the polycystic kidney disease. Thank you so much. If you like this video, please subscribe to our channel and comment on this video and give the thumbs up so that we can get appreciation and provide you many more videos like this in the future. Bye bye.